Hello, everyone, and welcome back to the Functional Feeling Podcast. Today, I'm joined by Christian Sohmen. He is from Micro-immunotherapy. We've actually done a podcast in the past that I believe was a couple of years ago now at this point, where we really dive into micro-immunotherapy's role in Hashimoto's more specifically, and also
Mhm.
provide more of an introduction to what micro-immunotherapy is. Today, we're really going to be diving into the use of micro-immunotherapy and the immune involvement in different gynecological conditions. So we'll be chatting through things like chlamydia and genital herpes, as well as HPV, endometriosis. It's probably something I'm leaving out in that mix, but different things that afflict women's health. And so we'll be talking through the immune involvement, as well as just providing a little bit more context into the role of microimmunotherapy. So thanks so much for being here, Christian, and welcome back.
Thank you very much for the invitation, Lorraine. It's a pleasure to be with you and your audience again. And it's a pleasure to speak about women's health, which I think is one of the most important application fields of microimmunotherapy. And it will be a pleasure to answer your questions and to explain your audience a little bit more about microimmunotherapy and how everything works.
Yeah, I'd love to. And, like I said, I think it's been a couple of years since you came on the show. And at that point, I think I just started using microimmunotherapy in practice. And so
Mhm.
now we've been using it for a couple of years and have really seen it just be such an instrumental tool alongside the other tools that we use clinically to be able to help women in their healing processes. And one of those symptoms and situations that often comes up are some of these gynecological conditions. And I think that oftentimes they're thought of as maybe even just being hormonal, or they're infectious. Maybe they feel that there's nothing they can do about it. That there is not a lot of modulation that can happen once these different types of situations present. So I'd love to just start off by talking through what role the immune system in general plays in women's reproductive health, and why do you feel like this conversation around immune dysregulation is so often overlooked in the conversation of women's health?
Mhm. Well, in basically, women's health and reproductive health is pretty much about immune tolerance. Because in order for a pregnancy to happen, you need the woman's immune system to be tolerant, but selectively tolerant with the fetus established in the uterus, which is composed 50% of foreign DNA, foreign cells from the father. And this is a major challenge for the immune system. And so the immune system, on one side, needs to be sufficiently tolerant in order to accept this challenging situation. And on the other side, it still needs to protect the woman from incoming pathogens and all sorts of immunological threats that the immune system normally deals with. So it's a selective tolerance that is needed, and immune disruption through all kinds of stressors, like, for example, stress, environmental toxins, a bad diet, sleep, poor sleep. All this disrupts the immune system, is causing imbalances, burdens in the immune system, and this situation impedes the pregnancy to happen, because it hinders the immune system from being selectively tolerant with the pregnancy. And in this field, microimmunotherapy can do a lot to establish or re-establish immune homeostasis, to re-establish the natural balance of things. And we are working with quite a lot of fertility clinics in the UK, and they have very good results with microimmunotherapy in this field. Um, they usually perform an exhaustive immune study in order to know exactly where the burdens and imbalances are, and then a very targeted therapy approach in order to remove these imbalances.
Definitely. And it's something we see often as well in our practice, especially when patients come in with a history of what often is called, at least in the US, as unexplained infertility, where they've been to various different providers and fertility clinics, maybe that have even told them that, we don't know why you're not getting pregnant, maybe hormonally and, within infectious workups and things, everything looks normal, but nobody's really diving into what's happening deeper into the immune system. And I find so often that that is really the missing piece for so many women, whether it's undiagnosed autoimmunity that's brewing or there's high viral load and different types of burdens that the immune system is bearing that's really affecting that immune tolerance, like you're talking about, which is such a key piece to
Absolutely.
pregnancy. So, for those maybe that are just unfamiliar with microimmunotherapy in general, that maybe haven't listened to the first episode, could you provide a little bit more explanation as to what microimmunotherapy is and how it differs from some other types of immune tools that are out there? I think predominantly like immunotherapy is what most people would compare it to.
Microimmunotherapy is an immunomodulatory approach, which is using immunomodulators. This means, above all, cytokines in low and ultra low doses. And the main differentiation with other therapies which are out on the market is the fact that we are using the active substances in very low concentrations, which are very close to the levels where the immune system uses them naturally. This is very useful because it provides microimmunotherapy with a lack of toxicity, with a very good tolerability, and with the fact that the treatment is very gentle. Another thing to be distinguished from other therapies is the sequentiality. As you know, immune reactions are following a sequence of different events over time. And every event that is happening during an immune reaction is mediated by a number of cytokines. And with the sequentiality, we are following this timely sequence of events, and we are trying to give the immune system in every single moment the precise instruction it needs to perform correctly. You can understand microimmunotherapy like the cytokines being the words of the immune system, and we are speaking to the immune system in its same language. Every capsule contains a slightly different combination of ingredients, which means every capsule is a full sentence, a complete instruction, which is given to the immune system in a given time. And the whole sequence is a message composed of different sentences in order to give clear instructions of different in different phases. Another important feature of microimmunotherapy is repetition, because it doesn't make sense to transmit this message only once. You have to transmit this message and repeat it over and over again in order to get a training or a learning effect and to put the immune system back in its natural way of functioning. And basically, these are, let's say, the main distinctions of microimmunotherapy with respect to other therapies. And one very important concept is that we are always seeking immune homeostasis. Microimmunotherapy is not suppressing and it's not boosting. It's always looking for a natural, sustainable way of functioning. And in this sense, it's a very gentle and well tolerated therapy.
Thanks for sharing that. And I'd love to start off by just diving into endometriosis more specifically, as this is I think, more and more well recognized as an immune and chronic inflammatory driven condition. Of course, there's still an involvement of hormones and other factors. But I'd love to talk through what are the immune mechanisms that are really involved in the development of endometriosis, and how could using a tool like microimmunotherapy play a role in being able to, like you're saying, modulate the immune response rather than, stimulate or suppress it like maybe some other therapies out there.
Mhm. On the immunological level, there are several things happening during endometriosis. The first thing that happens is a disruption of the humoral immune response. This means that there are IgG and IgA autoantibodies against endometrial and ovarial tissue. And this causes a chain of autoimmune reactions against this tissue cells. The second thing that happens is a disruption of the cellular immune response, notably the natural killer cells, the macrophages, and the CD8 plus cells do not properly work. And the third and most important thing is the inflammatory situation. There's a strong imbalance between pro and anti inflammatory cytokines or mediators in the immune system. And there is a tendency towards NF-kappa B mediated pathways, which are causing the presence of pro-inflammatory cytokines or the secretion of pro-inflammatory cytokines like interleukin 1, interleukin 6, TNF alpha, or interleukin 8. And there's another important thing that happens that is the fact that there are high levels of MCP1. MCP1 is a monocyte chemoattractant protein 1 and RANTES. And these substances have not only highly pro-inflammatory potential, but they induce angiogenesis and they induce the proliferation of the endometriosis foci. So they are aggravating the therapeutic situation. And from the microimmunotherapy point of view, what you can do in this kind of situations, the first go-to measure would be the formula inflam. The formula inflam is specifically developed for dampening overshooting inflammatory reactions. Notably, it is downregulating RANTES, as mentioned, which is a strongly pro-inflammatory chemokine. Um, so inflam would be the first thing to do in this case, even probably in a little bit higher dosage if it's a severe situation. And there are two other formulas of microimmunotherapy which can be used in this kind of conditions. One is Misem in order to regulate the neuroendocrine axis, because often endometriosis has also, as in the background, a hormonal disbalance between progesterone and estrogen. And Misem can help to rebalance this. Probably a good add-on would be a homeopathic remedy like Agnus castus, for example, which can also be used in this kind of situations. And the third formula, which comes to my mind, is Mirec, because Mirec regulates the mitochondrial system and it has an overall rebalancing effect on the immune system, which can help to bring things back into homeostasis. And it's a very important formula when it comes to avoid chronicity, drifting towards chronicity of a clinical condition. So these three formulas would be the go-tos of microimmunotherapy in cases of endometriosis.
Yeah, and so it sounds like there's this immune dysregulation picture that's happening with endometriosis, and there's a couple different ways that we can target it through the immune system. One of those is to lower that inflammatory overshooting response of the immune system that is causing this endometrial tissue to proliferate or to grow abnormally. The second is to be able to help balance out that hormonal environment. Because one of the things we know about endometriosis is that there's typically a higher estrogen state and inadequate progesterone. progesterone. So, like you said, with restoring that neuroendocrine axis, we're really helping the brain and ovaries connect better to be able to restore ovulation, hopefully, alongside other therapies to be able to do that and ultimately help create more of a progesterone balanced environment, because estrogen's also a growth hormone that's going to also cause growth of that tissue abnormally. And then the third thing is that mitochondrial influence of how, your mitochondria plays such a significant role in all of this. And, in my experience too with endometriosis, there's generally a lot of other like immune dysregulation patterns that are happening alongside of it that are causing more of this environment
Mhm.
where there's chronic inflammation and this HPA axis dysfunction where the brain and ovaries aren't connecting the way we'd want them to. And one of those pieces is just this like really chronically high viral load and,
Mhm.
the involvement of different viruses like Epstein-Barr, EBV, streptococcal, things of that sort. Can you talk a little bit about maybe the role that those types of viruses and that chronic viral load play in maybe not endometriosis specifically, but just an immune dysregulation more specifically, and how microimmunotherapy can be used as a tool to be able to help in those scenarios?
Well, in general, microimmunotherapy is a very good tool when it comes to addressing viral reactivations, especially from the herpes virus family. And these viruses are permanently triggering the immune system in the background when they are reactivated, and they are causing all sorts of disbalances, especially on the inflammatory side. And microimmunotherapy can specifically target these viruses, for example, Epstein-Barr, herpes simplex, or cytomegalovirus, and hinder their replication through the use of specific nucleic acids, which target one vital protein of the virus and hinders it from replicating successfully. So it helps to reduce the viral load, and it helps the immune system to come on top of the viral reactivation, to put it under control, and to clear the situation.
Yeah, which ultimately helps with improving that immune regulation, right? To be able to improve that immune tolerance, immune balance.
Exactly, exactly. So yeah.
And I think a lot of people have concerns, at least when I first talk with them, just about using some of these viral formulas and if that could potentially cause like an outbreak or a flare. Maybe if somebody has a history of genital herpes, and we're utilizing something like the herp formula to be able to, like you said, provide those nucleic acids, be able to modulate that viral burden and that immune load. Is that something that is possible, or is there any information you could provide for individuals that have concerns over that?
In general, we recommend using especially the herb formula, in case of an outbreak, when you already have an outbreak, because from the psychological point of view, it's not ideal when you start the treatment and after 3 or 4 days you get an outbreak and you start thinking that the treatment might be the origin, might have caused this situation. It's just not ideal from the psychological point of view. It is nothing negative if it happens, because it's just a sign that the immune system is starting to process the information given by the treatment. And it's absolutely normal in all kinds of modulatory treatments that there is a aggravation in the first 3 or 4 days, and then the healing process is starting. But as I say, from the psychological point of view, it's better to start the treatment once you actually have an outbreak, so that you start with the healing directly.
Absolutely. And with both genital herpes as well as chlamydia, those are both situations where we can utilize microimmunotherapy. They're obviously very different types of pathogens, but can both become really persistent challenges for women where they're just dealing with this chronicity and also that persistence of the reactivation. So, what are some of the immune factors that really determine whether these infections remain controlled or if somebody continues to deal with these recurrent outbreaks? And if they are dealing with them, is there a way that we can actually retrain the immune system to decrease the reactivation potential?
Yes. Well, first of all, chlamydia is probably the most frequent sexually transmitted bacteria, and it's a very frequent health problem that can cause a lot of associated complications, for example, inflammatory pelvic disease, PID, ectopic pregnancy, which means that the fertilized egg is not placed in the uterus but outside, usually in the fallopian tube. It can cause infertility or reactive arthritis. So, chlamydia is quite a problem on the clinical point of view. It's also quite hard to eliminate. And usually, to come back to your question, um, both chlamydia and also herpes simplex, genital herpes infections, are due to a very weak immune defense. And what you can do, address them specifically with the microimmunotherapy formula CHLA in the case of chlamydia, or with the formula HERP in the case of genital herpes. But you can also enhance the overall defense capacity of the immune system by, for example, using formulas like EID or even EIDN, which are mm, enhancing the overall defense capacity and which are um, yeah, promoting inflammatory pathways in order to get rid of these pathogens.
Absolutely. And that's something we see very often is so many women are dealing with this low defense within the immune system. I mean, very depleted white blood cells to be able to defend themselves in a situation of a bacterial or viral infection, really depleted gut immune function as well.
Excuse me?
And it's really a chronic problem that I see across the board. Is this something that you've seen as well? And is this something that you feel microimmunotherapy does a really good job at being able to help support?
Absolutely. In cases of a weak immune system, be it, for example, with recurrent bacterial vaginal vaginosis, or with chlamydia, with herpes simplex, um, microimmunotherapy can do a lot in a general way with, as I said, with formulas like EID or EIDN. This occurs especially when treatments, a lot of antibiotic treatments have been done, and the immune system is highly compromised. And the EID formula can help you to reestablish a healthy immune system and a balanced vaginal flora, for example, or gut flora, which is important.
Definitely. And that's really a common thread I see too with bacterial vaginosis or BV and yeast infections, where so many women that are
Mhm.
dealing with recurrent BV and recurrent yeast infections are just put on so many rounds of antibiotics and antifungals. And, maybe they're using suppositories like boric acid and things or topical treatments, but the infections just continue to recur. And
Yeah.
there is always the situation of this like depleted immune function where like the immune system, like you said, just doesn't have a capacity to be able to fight anymore. So maybe you can talk a little bit about with not just even the chlamydia and genital herpes conversation, but also with the BV and yeast infection picture. If somebody's dealing with these recurrent infections, what do they need to understand about the immune system's role and how pivotal of a player that plays in being able to prevent these constant recurrent infections that are happening after every round of antibiotics?
Yeah, that is the main problem, as you mentioned, that generally these vaginosis are treated with antibiotics, and with every round of antibiotics, a lot of useful immune cells get destroyed. A lot of useful vaginal or gut flora gets destroyed, and so with every round, the immune system gets weaker and weaker. and another round of antibiotic on top, you are in a vicious circle. And really, the best way of breaking this vicious circle is, instead of using one round after the other of antibiotics, to start using 3, 4 months of EID in order to reestablish a healthy and sustainable way of the immune system to function. And a healthy and sustainable immune system will be able to deal with this kind of bacterial infection or yeast infections without a problem. So it's everything about breaking the vicious circle and reestablishing a healthy and sustainable immune reaction with EID.
Definitely. And there's always a process to this as well that maybe you can speak to, which, is that like you're saying with like the EID or the EIDN, these are can be really powerful formulas for being able to help restore some of that hyporeactive immune state where like the immune system is very depleted. But maybe you can talk a little bit to why for like a patient, why it's not maybe in their best interest to just like go on those right off the bat, like why some patients there's more complexity and we really want to know what formula needs to be used first before the other formula, because the immune system is a very delicate balance, right? And if we use the wrong formula right off
Mhm.
the bat, it can throw things off in a way we don't want to.
Well, in general, microimmunotherapy has two levels of intervention or two ways of using it. On one side, you have almost allopathic way of prescribing it, based on symptoms, based on diagnosis that have been made previously, and you can go straight away with a formula and try the patient on this and with very good results. But in many cases, it's necessary to do a more into depth study of the immune system in order to check where really the imbalances are, which burdens are there in the immune system. Are there pathogens which are reactivated, etc., etc.? What is the inflammatory state? And with this immune testing, you can define a much more targeted treatment approach and help the patient more specifically.
Yeah, it's almost like an acute way of treating something. Like you're saying, if somebody has like an outbreak or a type of infectious process happening, utilizing microimmunotherapy as like a medicine, as a tool to be able to help them through that outbreak or that affliction, versus in the bigger picture, which is maybe more of the long-term play for people that have more of this complex immune dysregulation, which is really understanding, okay, what's driving the immune dysregulation and what domino needs to fall first to be able to start to restore this immune balance and this immune tolerance. Is that correct?
Exactly, that's absolutely correct. And it helps you, as you say, also to sequence the treatment, to define the priorities. Which problem do I need to address first in order to get to the second problem, the third one, etc., etc. So it gives you a hierarchy of what you need to do first, and it helps you to get a good treatment plan.
Definitely. Okay, let's talk through HPV. I think that this is a very common affliction for women. So many women have had, vaccinations and things to try to prevent HPV. And then oftentimes what we see happen is that, maybe we start to see that these abnormal cells are developing as a woman goes through their 20s and maybe 30s. And then, maybe their immune system then ultimately is able to clear the HPV and it doesn't become a situation of cervical dysplasia. Other times, this HPV, the immune system doesn't naturally clear the HPV, and now the HPV maybe proliferates, and we have more issues happening that could lead to a potential risk of things like cervical dysplasia or cancer down the road, and it becomes more of a risk factor where women are worried that maybe they need to have a operation to be able to help with removing these abnormal cells. and it becomes kind of a concern. And I think that for a lot of women, that don't want to undergo something like a LEAP procedure, which can be very painful, their options are very limited in terms of what else can be done to be able to help clear the HPV. They're often told, from like an allopathic conventional medicine perspective, that there is nothing really beyond waiting and or going through with a LEAP procedure. But maybe you can tell us a little bit more about the role of the immune system and what somebody that is in this type of situation needs to know about how the immune system plays a role in HPV outcomes.
Well, the immune system plays a fundamental role in HPV outcomes. And actually, the nice thing about microimmunotherapy in this context is that you can exactly use the usual time frame um, of watching and waiting that you have mentioned when you have a suspicious smear test at the gynecologist and the next follow-up testing is usually proposed after 6 months. And microimmunotherapy offers you exactly the possibility to use this time where you normally sit and wait if the situation clears naturally, if your immune system is strong enough to deal with the HPV infection, or to the contrary, if you are drifting towards cervical dysplasia or even a cancer, cervix cancer further down the road. That is a very unpleasant situation, a very unsatisfactory situation, a lot of anxiety, and microimmunotherapy can help you to fill this gap of 6 months with doing actively a treatment with the formula PAPI, which is specifically designed to address the papillomavirus and which helps you or helps the immune system to clear this virus, to hinder its replication. And in most of the cases, after this 6 months time window, the next follow-up smear test will be clear and the problem is solved. Two important considerations. First of all, the HPV virus is generally transmitted through sexual activity, and that means that it is recommended to treat the partner as well, because males are usually symptom-free porters and transmitters of the HPV, and through sexual activity, you engage constantly in reinfection, which to some degree counteracts the treatment. Therefore, we recommend doing in parallel a treatment also for the partner. And the second thing is that papilloma also is frequently found as the root cause of pharyngeal cancers, for example, condyloma, anal condyloma, all sorts of other clinical pictures which have to do with oral or anal sexual practices. And that also needs to be addressed with the formula PAPI. And the third thing that is very important, if already you are in a situation of CIN 2 or 3, that means that already abnormal cells are present in the cervix tissue. You should take the formula PAPI and the formula C1 for 6 months, one capsule of each formula per day, in order to address also the proliferation of abnormal cells, because that's important in order to avoid cancer further down the road.
Okay, so that would be the addition of the C1 would be in the situation where somebody already has those abnormal cell development processes, but maybe isn't quite at cancer or cervical dysplasia. Is that correct?
Exactly.
Yeah.
It's just in order to stop the proliferation of abnormal cells and to avoid that it becomes a cancer further down the road.
Amazing. Okay. Thank you so much for sharing that. And I think that'll give a lot of women hope because, like I said, I think that so many women I talk with, they feel so hopeless when they have a diagnosis of HPV and oftentimes a lot of these different gynecological conditions that there just really isn't a lot to be done. You mentioned the partner also being treated for HPV. Would that also be your recommendation in a situation like chlamydia or genital herpes?
Yes, that would also be the recommendation because the mechanisms are basically the same. Yeah.
Wonderful.
So
Okay, great. So, really, when we're thinking about all these different conditions, I know we explored a lot. We talked through endometriosis, we talked through the recurrent bacterial and candida vaginal infections. We talked through genital herpes, chlamydia, HPV. Are there any commonalities within immune patterns that you see? Like, are typically women that are dealing with these types of infections always dealing with this hypo, reactive immune state where they're, in a really depleted situation? Or do we sometimes see a hyperreactive immune state where there's a lot of like overshooting of the immune system, or any other types of patterns that you often see between these different types of recurrent gynecological
mhm.
conditions?
Yeah, well, we see a lot of, as you say, mainly what we see is depleted immune systems due to our current lifestyle, due to a lot of stress, due to bad living habits, lack of exercise, poor sleep, poor diet, etc., toxicity. So in many cases, the immune system is more on the depleted side. Uh, Due to our experience, I would say even 85% are in the depleted area, but there's also increasingly I would say probably since COVID, that you can see a lot of overshooting immune patterns, overactivation, and at the same time, exhaustion. So you see mixed pictures of tendencies towards autoimmunity, lymphocytosis, but on the other hand side, the defense cells like T8 cytotoxic, for example, they are completely depleted because they are exhausted after such a long time fighting fruitlessly against infections. So that is mainly yeah, what we see.
Definitely. It's definitely what I see too, especially like you mentioned with that long COVID or that post-COVID picture of just, that hyperreactivity, which often presents as a lot of like histamine intolerance or a lot of sensitivity and reactivity to changes in environment, whether it's
Mhm.
exercise intolerance or supplement intolerance and just difficulties with, responding to a lot of different treatments.
Yes. In that kind of situations, you have a wonderful tool with the MyReg formula because the MyReg is really the go-to when it comes to disbalanced immune systems, when it comes to situations where you are drifting towards chronicity. And it's very important because the mitochondria are always, or nearly always compromised in chronically ill patients, and oxidative stress is also playing a role. And MyReg can rebalance this kind of situations very nicely. So that is really an important go-to formula in a lot of situations, especially when you have these kind of patients which are hypersensitive, do not react well to whatever supplement, whatever treatment. There, MyReg is really a wonderful help.
Definitely. I love my reg as well. Thank you so much, Christian. I really appreciate you coming on to provide more explanation of the immune role and I think ultimately just hope for a lot of these situations as well. For anyone that is listening that is curious about microimmunotherapy, this is a treatment tool that we use in our practice. It's used alongside of other treatments like nutrition, lifestyle, vitamin, herbal, supplemental interventions, to be able to really not just modulate the immune system, but really look at the bigger picture. Because like we discussed with, endometriosis and with some of these gynecological conditions, there's often a hormonal involvement. There's often a long-standing history that's driving the immune dysregulation. We mentioned the HPA axis and the neuroendocrine involvement and how these systems can become really depleted, which then causes the immune system to become depleted. So it's really utilizing the microimmunotherapy alongside some of these other tools to be able to then change the environment of the body so that we can then ultimately restore balance and homeostasis within hormones and within overall bodily functions.
Hmm. Exactly.
Yeah. Thank you so much, Christian. I appreciate it. And I'll talk with you soon.
Okay, thank you very much for the invitation, Lorraine, and have a wonderful day.